You're tuned into Times Now. Very good morning to all our viewers who've tuned in this Sunday morning. This is the newspaper show with me, Poonam Burde. For months now, several people have not been getting their newspapers at home. You pick up your morning cup of tea or coffee and you do not have a newspaper to read, a habit which all of us have inculcated over years now. For that, we are going to get you what makes headlines in the top newspapers of this Sunday. We are going to begin with the Times of India. This, of course, is the Delhi edition that I'm going to begin with. But the Times of India talks about the biggest headline is what is the plan ahead for India, especially Delhi, because the need to curb the spread of COVID-19 is extremely important. The Delhi Chief Minister, along with Home Minister Amit Shah and the Lieutenant Governor today is going to hold a meeting. They are going to talk about what needs to be done and the road ahead really for the national capital. Because remember, the number of cases in the national capital are only increasing day by day. It was only Mumbai up until now, but even Delhi now is a cause of concern. Another big headline that is in the Times of India today is about the move that came in from the Nepal Parliament yesterday. Nepal House clears new map, untenable, says India. It's an artificial enlargement of claims. That is what the Ministry of External Affairs has reacted to what Nepal did yesterday. What they did was the Parliament voted to clear a map of the country that includes several territories that belong to India. Disengagement on in Ladakh is also what the Army Chief has said. Remember, the standoff at the line of actual control between the Indian Army and the Chinese Army has been going on for several weeks now. There is disengagement on, especially in Ladakh. That confirmation is coming in from the Army Chief there. We also now have, like I was mentioning, the number of cases in the national capital are increasing. Delhi now has the second most active cases after Maharashtra. Unfortunately for the national capital, 2,000 plus cases in the city for a second day in a row have now been recorded. Gangaram has now been allowed to resume RT-PCR tests. Remember, the hospital, Gangaram Hospital, was under the lens after an FIR that was filed by the government of Delhi against the norms that were not being followed at that particular hospital. Some good news coming in this Sunday morning. There is a revival sign. Hiring is up in some sectors. Remember, over the last couple of days, the economy has taken a hit. Several sectors, like the aviation, have also had issues. We've seen several people being laid off. There have also been issues of salary cuts across different sectors. But this is a piece of good information that is now coming in this Sunday morning. Several sectors are showing some sign of revival. That is also what the intention was behind opening up India, even at a time when the number of cases is only increasing. There's a little excerpt called a job alert in the Times of India, which talks about during lockdown, recruitment volumes down nearly 80% for some firms. That was the big concern as far as reviving the economy is concerned. These have come back to 50% of pre-COVID levels, so about 30% gap has now been bridged. That is good news. With focus on contactless delivery, roles in fintech and digital are also in demand. So those are sectors that are now booming in the times that we would call post-COVID era, really. Moving on, now the government has added loss of smell, taste to its list of COVID symptoms. Remember, this is a disease that, unlike any other, we do not know how really to deal with. Every day is a new day. The WHO also reviews really of how to deal with COVID every single day. The Indian government is also doing the same. This one talks about a reviewed list of COVID symptoms. Loss of smell and taste is also one of the symptoms now, including what the other list was, that includes cough, cold and flu-like symptoms. COVID deaths have now crossed 9,000 mark. 12,000 plus cases on Saturday in the last 24 hours. That's the bit of unfortunate news coming in for India. That's what we're tracking for you in the Sunday Times. We're also going to get you what the Navbharat Times is talking about. Remember, the biggest headline, of course, in all the newspapers is about the COVID count and the tally in the country that is increasing. But the silver lining, of course, has been the recovery rate, which has been steady ever since the uptick in the cases has been witnessed. That is a big headline in the Navbharat Times today. Recovery rate ki 50, tezi se theek ho rahe hain mareez. This talks about the recovery rate, which is now at 50% as far as cases are concerned. There was a time a couple of days ago when the number of recoveries was great. greater than the number of active cases in the country. That, of course, comes as a big relief. Remember, Delhi government has, over the last couple of days, spoken of how they will not be able to deal with the number of cases that the city faces. There will be a shortage of beds. That's an admission that had come in not just from the Deputy Chief Minister of the national capital, but also the Health Minister, the Chief Minister himself. This big headline talks about 30 June tak jitne bed chahiye uski 20 tak kar lenge tayari. This is what the Delhi government has said. Delhi ke Swasthya Mantri ka dawa hai ye, Satyendra Jain, who is the Health Minister of the national capital, has said that until the 20th of this month, they will decide, figure out a way of how the national capital will deal with the number of beds that they will require. 27,000 at least is what they need as far as the projection of the Aam Aadmi Party government is concerned. Another bit of information which of course is of public interest is the fact that borders of several states have been sealed. Delhi, Uttar Pradesh also is one of those borders. Delhi opened up, but Noida, which is in Uttar Pradesh, still has an issue with that. Delhi-Noida border par fir jam ne kiya bedam. That has been a problem. The chaos at the DND, at the Delhi-Noida Delhi Expressway has been a concern for several days now. We've seen traffic jams that have gone on for hours together. We've seen cars piling up, vehicles piling up. Massive confusion there because the DM of Noida really has become a law unto himself, is what some would say. That's the Navbharat Times for you. Economic Times also is what we're going to look at next, because the economy, remember, in post-COVID era is now looking to revive itself. The projections for India's economic growth have been bleak, some would say, but also they're not as bad as what some naysayers would really put us at. Economic revival is going to be key. Now, in the Economic Times magazine, which is what comes out on Sunday, crossing the data line is their cover story. It's hard to define a Chinese app, and therefore bans and boycotts cannot be a robust response to their popularity. India should build platforms with its own cultural and political ethos. This one is an in-depth analysis of what really happens once chorus grows for boycotting apps. This, of course, is in the backdrop of the controversy that has been brewing over Chinese-owned app TikTok, and the call for boycotting not just Chinese apps like TikTok, but also Chinese products that has now been increasingly growing in the country. Another information coming in the ET magazine is that India-China disengaging in a phased manner. This is what the Army Chief General Naravne has said. Remember, over the last couple of days, these skirmishes have been witnessed at the line of actual control. We did see meetings between the Indian Army and the Chinese Army, and that is bearing fruit now. The Army Chief himself has come out and said that both India and China are disengaging, and that is happening in a phased manner. European nations and India's S2 signed vaccine deals with AstraZeneca. That's the big piece of information. Of course, we are talking about living with COVID-19, living with coronavirus, but a vaccine is soon on its way. We're hoping a trial sometime happens in the next couple of months, and we do see the rolling out of a vaccine maybe sometime next year. That's the piece of information coming in from the Economic Times. We are going to move to the Delhi edition now. We are going to bring you what each of these city editions hold for our viewers. We'll begin with the national capital. The one in Delhi, of course, is about the crucial meeting that is going to take place today. There is going to be a review of what lies ahead for the national capital. Parveena joins us for more details on that. Parveena, what is expected to come out of that meeting today?
Well, remember, this meeting is taking place amidst a lot of differences which we have seen between the Delhi government and its cabinet and opposition parties, and as well as Lieutenant Governor, because there's a lot of gap which we have seen in the recent times with the data which has been shared with people as far as the death rate is concerned, the death rate of COVID positive cases. Now, what we know that the Delhi Chief Minister Arvind Kejriwal, Delhi Lieutenant Governor Anil Baijal, and also AIIMS Director will be meeting Home Minister Amit Shah. Also, Union Health Minister Harshvardhan will be present at the meeting. They will be updating about the status of all the private and also the state government and the central government hospitals which are catering to COVID patients, and the kind of beds and the number of beds which we will require by end of July as well. Remember, the state government has already said that by end of July we will need at least 80,000 more beds, and there will be over 5 lakh cases. That will also be discussed today as to what is the state government planning.
Absolutely, because it is really how the state and centre work together across the country, but especially in Delhi. That is going to be of prime focus in that meeting today. Thank you, Parbeena, for joining us with that. Moving on to what the city edition of Mumbai holds this Sunday morning. The biggest one is about the nod that the state government is now looking at from the central government to resume local services. Remember, local trains in Mumbai are the lifeline of the city. It's not just for the movement of everybody else, but also essential staff, essential services, people who have been medical staff, policemen, all these people who have been traveling to work have been finding it really, really difficult, and the government is hoping to resume these local services to ensure that their travel is easier. Arunil is joining us for more on that. Arunil, Uddhav Thackeray for months now has been demanding that. We're looking at some resolution soon.
Well, Poonam, Maharashtra Health Minister Rajesh Tope, in fact, had a meeting with the Central Health Minister Harshvardhanji, and that time also such kind of a demand was put forth. That's what we understand. And yes, CM Uddhav Thackeray and several other ministers from Maharashtra have been raising this concern, saying that basically local train services need to be open in the city of Mumbai, because as we see, mainly people who are traveling from the satellite cities of Mumbai, be it Thane, Navi Mumbai, Vasai, Virar, they also work in essential services, and getting them to the mainland city, trains were only the viable option. In fact, the BST buses are trying to make up for it, but we have seen how overcrowding it has been getting in BST buses also. So that is also risky to a certain extent. But yes, now we understand that by tomorrow, at least the local trains can be expected to start for essential services. There is no confirmation as yet, because the railways are still mulling about some decisions that they will have to make, how essential services will be given passes, and how their railways basically will be employing their staff to ensure that maximum social distancing can be followed. If we remember, some time back, the railways had started for essential services, but overcrowding could be seen in the coaches of local trains.
Right, maintaining social distancing, overcrowding, that has been a problem, especially for Mumbai, which is, some have called it infamously the COVID capital of the country. Thank you, Arunil, for that. Moving on to Bengaluru now and what that city holds. Unfortunately, two bits of information that are not so good news coming in from Bengaluru. One is about Bengaluru's top COVID hospital has only 2 dialysis machines. That's a big problem there. There is details of this top hospital and why it's a worry for that particular city. There's also talks about how many are struggling to rejoin work because there are several hotspots really across Bengaluru, and people who are part of that hotspot are finding it difficult to get to their workplaces. These people also include those who belong to essential services. But the biggest headline in the Bengaluru edition of the Times of India today is about a new order that is likely to come in from the civic body of Bengaluru, which is the BBMP, and this talks about how there will not be any more containment zones. Any case that comes up in a particular building, only that particular house or that particular floor will be sealed, unlike what we've seen in the past. Deepak is joining us for more on that. Yes, Deepak.
Well, we had brought the details across before that the government was speculating. Now it looks like it's going to be effective very soon, where the government is moving out of containment zones where entire areas would be blocked, preventing even the others from going to work, carrying out businesses, and overall affecting their lives and also the economy. And that's where the government now wants to strictly impose containment homes. For example, if there is an entire apartment with about 1,000 residents, if there is a floor where there is a case detected, they would probably block that particular floor, a floor above and the floor below, and strictly contain that zone but not the entire apartment. That's the idea of the government going forward.
Right, Deepak. So far, Bengaluru has maintained to keep a steady pace as far as the uptick in cases is concerned as compared to other metropolises, but they are taking no chances. Moving on to what Kolkata in West Bengal holds for us. Remember, there have been several charges against the state government there about how they're really underreporting the number of cases. We have seen the mortality rate there also is pretty high. The number of cases in West Bengal is pretty high. The state government and the centre are working to ensure that this does not happen. Tamal is joining us for more on this. Tamal, we're given to understand that apart from everything else that is happening, economic revival, of course, is the key focus now. We're given to understand that Realty project deadlines have now been extended by the state government.
Well, that's right, Poonam, principally because there is a migrant crisis. Why? Because the migrant workers who were working at these very projects were mostly from adjoining states like Odisha, Bihar, Sikkim, and they have all left for their native land. So yes, because of that imminent labor crisis, there was, there was a lot of uncertainty looming over these projects. However, the state government has now extended the deadline by 9 months with additional buffer period of another 3 months, which means the projects might take another year to get completed, and those who are invested in those projects, for example, if I'm a buyer and if I'm supposed to get the handover by this month, I do get an extension of another year to even pay for my EMIs, pay for the property. So it's a win-win situation both for the proprietor, at the same time for the buyer, and that's exactly what the state government had decided to do. Yes, a lot of migrants have come back to Bengal now. Using them or channelizing them for such projects, for the completion of such projects, would mean employment for all these migrants. At the same time, would also mitigate the labor crisis which is here. So at this point in time, the housing department of the state government, specifically for all the projects that come under the state government, a deadline extension has happened for 1 year, where almost a year, 9 months first, and another buffer period of 3 months, where projects might get completed, will get completed, and the buyers would also get time till then to pay for the entire project.
Absolutely, it's a win-win situation, not just for the property developers, but also for home buyers there in Kolkata. Thank you for joining us with those details, Tamal. Moving on to Chennai now. Chennai has been a hotspot and a major point of worry, not just for the state government, but also for the centre there. Shabir is joining us for more on that. Shabir, now the state government was facing allegations of underreporting, misreporting number of cases as far as Chennai specifically is concerned. The top headline in the Chennai edition of the Times of India is about how the one-day death toll has now gone up to 30.
Well, that's right. Already a committee has been formed after allegations that the Tamil Nadu government was underreporting the death rate, the number of deaths that are taking place due to COVID-19, and after reconciliation, the process of reporting these deaths have begun. Yesterday, at least 7 to 8 deaths that took place 3 weeks ago have been reported in the medical bulletin that was issued by the Tamil Nadu Health Department. So there are also many discrepancies that have not come to light. In fact, there are the 2 officers who are directly responsible for accounting these deaths are part of the committee. So that is also a problem. So clearly, the health department officials are now sitting on a data where they have to go through each and every death, and they have to report these deaths. If it is a COVID death, then it will figure in the Tamil Nadu medical bulletin. So that's how the arrangement has been made as of now. But still, there are many deaths that have gone unreported at the hospital level itself. So that is also one of the big concerns, particularly Stanley Hospital. Many deaths have not been reported, is what people are saying. And also, at the mortuary, the reference of COVID-19 cases were deleted after the patient died. So these are all a lot of discrepancies that have come to light. Now the committee, whether it is going to look into all of this, that is something $1 million question.
Right, only time will tell of what really comes out of what the committee report is submitted, what they find out, and what action really is taken. Shabir getting us all those details. Moving on to what is making headlines worldwide. The biggest one, of course, is coming in from Beijing, which is China, remember, is where coronavirus emanated from. Beijing is now into wartime mode after a fresh outbreak. 53 have tested positive after virus cluster was found at a market. 11 localities have now been shut. Remember, Wuhan, the epicenter of where really coronavirus emerged from, has not seen a single case for several months now, but now 53 have tested positive, and the Chinese government is fearing a second wave of coronavirus there. Another news coming in from the United States, where amid all the racial strife that we've seen after the death of George Floyd, good news coming in there now. 23-year-old PIO is the first observant Sikh to graduate from a US military academy. Anmol Narang is the name of this person who has graduated. She's the first observant female Sikh to graduate from the West Point Military Academy. The graduation was yesterday. Donald Trump, the President of the United States, also spoke about not just her, but in general about the diversity of West Point's graduating class, and appealed for America's newest officers to uphold the country's core values. This comes at a time when his administration really is bearing the brunt of how they've handled the whole Black Lives Matter campaign that has been seen across the country in the last several weeks. Moving on to news from the sporting world now. Shahid Afridi, Pakistani cricketer, has tested positive for COVID-19. That was information that came in yesterday. Remember, he runs an NGO in Pakistan that works with patients of COVID-19. But also, all those sporting fans who have been missing some action for the last couple of months, Italy is at it now. The Copa final is what we are tracking. Karishma is getting us all the details. Yes, Karishma.
Well, yes, Poonam, absolutely. It is good news for all sports fans and football fans, especially with the Coppa Italia resuming yesterday after a 3-month gap. And what we're given to understand is that Juventus have made it to the Coppa Italia final, even though Cristiano Ronaldo missed a penalty. But Juventus, on the basis of away goals in the match that was played in February before the pandemic broke out, on the basis of 1-1 away goal, have made it to the Coppa Italia final. So obviously it is good news for Ronaldo fans, Juventus fans, and also the fact that sporting action has resumed in Italy after a gap of 3 whole months, and there are reports of Italian government allowing fans in the stadiums in July. So all in all, good news for sports resuming back.
Right, we're also likely to see IPL sometime later in the year. Karishma, we are of course tracking all the developments there, but thank you so much for now. Moving on to this Sunday morning and what really the entertainment section holds for us. This is the Delhi Times. It is the entertainment section of the Delhi edition of the Times of India. It leads with an interview with Maestro A.R. Rahman. It talks of proud of the diverse talent present in India. The bar is now being set really high. This is an interview with A.R. Rahman, which the Delhi Times is leading with. There's also an interview with Kiara Advani, where she talks of how she never refuses a selfie with a fan because that makes her feel guilty. A co-star told me that you should want every single fan of yours to have a picture with you. That is the ultimate goal, as per Kiara Advani. Angelina Jolie is also on the front page on the Delhi Times, really, where she talks about the whole Black Lives campaign that has been going on in the United States. She says a system that protects me but not my daughter is intolerable. But that is a wrap from me on this edition of the newspaper show.